The COVID-19 pandemic.
This is real. It's a real virus, and it's an invisible enemy.
We've spent weeks at home.
If we're going to stop the spread of the virus, this is our window.
Even though I know I'm taking the right safety precautions, other people might not be.
Businesses shut their doors.
Everybody has to navigate this in the best way they feel possible, that's safe.
If our store are closed, we have no more business. So we don't have the choice. We need to reopen.
Healthcare workers forced to the front line.
It is exhausting emotionally, physically, and just exhausting the work that we do.
Now, as North Carolina begins to reopen,
Phase 1 is designed to be a limited easing of restrictions.
People want to work, people want to have somewhat normal activity in their lives.
how will we recover?
For those of us who have gone weeks without a paycheck, our debts get higher and higher.
It's going to be hard, and I've been struggling.
North Carolina U.S. representatives answer your questions live. This is COVID-19 Response, a congressional town hall.
Good evening. I'm Angela Taylor.
Hello, everyone. I'm Russ Bowen. Thank you for joining us tonight for our virtual town hall. We invited all 12 of our current U.S. representatives to answer your COVID-19 questions. 8 representatives accepted our invitation and are joining us live now. North Carolina, made up of 13 districts, and tonight we're joined by representatives in Districts 1, 3, 4, 6, 8, 9, 12, and 13. And we should also let you know that District 11 is currently vacant. Representatives in District 2, 5, 7, and 10 tell us they had previous engagements.
Our congressional town hall is broadcasting live on 6 Nexstar-owned TV stations from the mountains to the coast. And we have questions from you, the viewers, all across the state.
All right, let's get right to it with a lightning round. Phase 1 of reopening North Carolina went into effect on Friday evening by a show of real hands. Who thinks we opened too early? Well, that's interesting.
Very surprising.
Bipartisan, completely bipartisan agreement there. I'd like to start with Representative Hudson. Your thoughts on this?
Well, I think we're all anxious to get reopened, and, we can't borrow and spend enough money to get us out of this. We've got to grow out of this, and we've got to get businesses back up and running. We've got to get economic activity happening. And I know folks who are watching this at home right now are feeling anxious. They're ready to get on with their lives. But we also have to be very careful. We have to do this in a safe way. There are a number of people out there who, whether because of your age or because of underlying health conditions, you're still at great risk. Those folks probably have to stay home a while longer. But for the rest of us, and particularly in parts of our state that aren't experiencing large case numbers, I think it's perfectly reasonable to start opening up. But we got to continue to socially distance. We need to wear masks when we're out in groups. There's a lot of, we need to be smart about it, but we need to get things open as quickly as possible.
Right. Congressman Hudson, thank you. Congressman Bishop, let's hear from you.
Well, I'd echo Congressman Hudson. We need to be, North Carolina is in pretty good shape as compared to a lot of states who have had worse experiences. It's important that we reopen along with other states. We can do so safely, and I think people will cooperate with that. But we've done a lot in legislation to provide relief from Congress, but it also is clear that the federal government cannot displace the economy. People want to get back to their jobs and to their lives and to their churches, and we need to be able to get on with that just as quickly as we can do so.
Congressman Bishop, thank you. And we'll talk more about that relief a little bit later. But the latest numbers from the state show that to date, 15,346 people have tested positive for COVID-19. 577 people have died. And this brings us to our first viewer question from Matthew in Henderson.
My name is Matthew Jankowski. I'm from Henderson, North Carolina. My question is, how quickly will you shut down the state after you do your soft opening if you notice that there's an uptick in new cases?
This question directed to Congressman Butterfield, who represents Henderson, and Congressman Budd, who's on the Financial Services Committee. Congressman Butterfield, while it's left up to the states to make the decision, do you think we should shut down again if we see an increase in cases?
Well, let me tell you, governors, not just our governor in North Carolina, but governors all across the country must make very, very difficult decisions. And I support Governor Cooper. I think that he has set an example for the rest of the country. He made these decisions based on science and what the data tells us. We are flattening the curve in North Carolina. We are coming out of this situation by the day, but we still have a long ways to go. If by chance we see a resurgence of virus, I think we need to again shut down businesses and make our community safe. But once again, we must be guided by the science and not by politicians.
Okay, and Congressman Budd, your thoughts on if we need to shut down again if we see an increase in cases?
That was a great question from your viewer. I just want to say, look, as the number of cases grow, it's really because we've invested a lot of dollars into testing. We put billions of dollars into this with the recent CARES Act. So we're going to grow, if you want to look at it like a mathematical formula, we're going to grow the denominator, which is going to mean that the fatality rate is actually going down. So I think as we grow more testing, that's not necessarily an index, or as we grow more cases, that's probably a sign that we're doing more testing, not that there's more per population in reality. It's just that we're finding more that's actually out there, but it's also driving the fatality numbers down. So I would say we really have to look at what the numbers mean and be very careful. But I would be very cautious about shutting down and very aggressive on reopening, because I think that's what we need to get back to here in North Carolina.
All right, thank you. Now, due to COVID-19's pandemic and the state shutdown, we are seeing record unemployment numbers.
In April alone, the U.S. lost more than 20 million jobs, and right now, the unemployment rate is 14.7% nationwide, with 33 million people applying for benefits. In North Carolina, we know at least 1.4 million people have applied for unemployment. So here's Paula's question from Wade County.
And I won't be going back to work anytime soon. And now we're all worried about what happens when our unemployment runs out, because that's going to happen shortly.
So this question is for Congressman David Price of the 4th District and Congressman Mark Walker in District 6. Congressman Walker, we're going to start with you. You serve on the Higher Ed and Workforce Investment Subcommittee. Is Congress considering extending unemployment benefits at all?
Well, right now, we are monitoring to see what this phase one looks like when it comes to the amount of money. We've allocated $600 a month, a week for the different people who've been unemployed. This was both to help the unemployed as well as the employers. What we are concerned about is once these businesses start opening, is that going to be a deterrent for some of these folks to return to work? Is it enough? No, you can make the case that it's never enough for somebody that's struggling at this time. We're doing everything that we can, but we want to make sure before we pass another $2 or $3 trillion of future debt on our children and grandchildren, we want to make sure that this is getting to the right places. And we are seeing some good reports back that it is sustaining folks at this point. But that's the key issue in all this. That is why we have to be really passionate and pursuant about reopening these businesses, doing it safely, but allowing people to get back and find that self-worth, finding that they matter, to be able to invest back into this economy.
All right, Congressman Walker, thank you for that. Congressman Price, you weigh in.
Yes, we need to make sure the unemployment benefits are there as long as they're needed. In this new legislation that we're going to be voting on in a few days, we extend the unemployment benefits, that is the federally supplemented unemployment benefits, until the end of the year. Now, if we don't need it, that's great. But people should be assured that if that support is needed until they can get on their feet and get back in the workforce, then they'll have it. The other thing we're doing, of course, is so-called payroll protection. That's the aid to small businesses and nonprofits. The idea there is to keep payrolls intact and keep people on the payroll with their benefits intact. One or the other of those two protections needs to be there for our people.
All right, Congressman Price, thank you. A lot of people worried about being able to pay bills and put food on the table. Here's Cynthia's question from Greensboro.
My name is Cynthia Wright, and I'm from Greensboro. I'm wondering if we're going to get another stimulus check, and when would we possibly get it? And I'm wondering how it's going to affect people who are working, maybe not working, people who have children or senior citizens.
So this question is for Congressman Murphy in District 3, Congressman Bishop in District 9, and Congresswoman Adams in District 12. Congressman Murphy, we will start with you. Would you support a second stimulus payment?
Well, I think we, and I've been afforded to be able to look at this entire pandemic just kind of through the eyes of my profession, just through a physician. And I think the initial stimulus check, well, I really don't like to call it a stimulus check. I like to call it a stabilization check. Because what we did is government basically shut down business across the nation. We shut it down across the state. And in doing so, we understood that this was a government mandated shutdown, that people needed some stability to carry us through to a time when we can safely get people back to work. I will tell you, I'll not be in favor for a stimulus check to go to an illegal immigrant like we had before. Let us make sure before we go doling out another $3 trillion, let's look and see what happened before. Let's see what has happened with the economy, what's happened with our businesses as we are now able to use the science. And this is something that, believe me, I've studied tremendously. We're able to use the science to begin our nation on a path back forward towards normalcy. But again, using smart techniques, social distancing, wearing masks. People want to work. Our employers want to get back to the business. That gives people self-esteem. It gives them their reason to live for. I don't think that it's this role in government is to perpetuate dependency upon people. I don't think that's what they want. I don't see the need for us to really create further government bureaucracy and dependence because of this crisis. We were there to stabilize at a time that we needed to. I believe now that we know what we've experienced, we know the science, believe we know we can now start moving safely forward to get people back to work.
Okay, thank you. And Congressman Bishop, would you support another stimulus check?
The original $2.2 trillion CARES Act that included that part also included a number of other types of relief. All that is still playing out, but it was all designed to sort of get people through the close down. Now that we are entering into the reopening, there may be a need for additional types of help to the economy, but it should be a recovery package rather than that same sort of sustainment package. And so there'll be different things that are needed. So right now we need to see how it plays out. The Federal Reserve is still loaning money to a lot of companies. They're still getting PPP, small businesses still getting Paycheck Protection Program loans. So a lot of that, we just sort of need to monitor and see how that plays out before we decide what exactly is next. But it needs to be a recovery package.
Okay, and Congressman Adams, yes or no on another stimulus check?
Absolutely, yes. Yes, we, I think, did a good thing to provide the $1,200, but clearly we know that that is not enough. As a matter of fact, it's probably not even enough for people to pay their rent. But I think the most important step we can take is to put cash in the hands of our families. They're struggling. Otherwise, the economy is just going to come to a screeching halt, and it will cost us even more in the long run. I think during the 2008 crisis, we learned that government just can't sit back and let working and middle-class families see their futures evaporate. We did say, shut down your business. And we do have a responsibility, I think, to help our citizens. That's why I'm working to keep families in their homes and to lower the burden of student loan debt and to make sure that all families have the food assistance that they need. So yes, I will be happy to support another one because I know that what we did is not enough and people are still hurting and they are relying on their government to come to their aid.
Okay, and we'll talk more about that student loan debt coming up a little bit later.
That's right. Well, today the House introduced a $3 trillion relief package that is expected to be voted on Friday. So knowing what you know about that package today, and trust me, we know these things can seem to change by the hour. So let's just go by what we know right this moment. By a show of hands, who would vote yes for this package on Friday right now? So we have 3 saying yes.
Okay, we're going to give each person 30 seconds to explain why. And let's start with you, Congresswoman Adams.
Well, as I just said, I think that we owe it to the citizens to continue to help them to see their way out and to at least let them know that they do have something else coming. What we provided is certainly not going to be enough to sustain them. So I would be supporting another stimulus package.
Representative Walker.
Yeah, I think it's a problem. It's kind of a wish list, kitchen sink, throw it in there if you've got something in the past you'd like to try to hang over this time. Let me just give you one example. The top 1% benefit tremendously in this with the repeal of the state and local taxes, what we call SALT. That to me is goes against my grain in the sense that everything that we should be focused on right now is to be able to offer the relief for those that are struggling or those impacted by COVID-19. Putting these other items in there, there's a great time for debate in the future. I just don't think it's right now.
And Congressman Murphy.
Yeah, you know, when we first entered into this crisis, I thought, wow, this is going to be a great time for our nation to come together, like 9/11 or any of the other crises, because we as a nation were battling this. I've been very disappointed because this bill, this 1800 bill, was just presented to us just a few hours ago. And looking at its snippets, unfortunately, you know, the first part was, the first CARES package was done with some bipartisan work. Unfortunately, this has literally been with no Republican input. And, you know, that's not the way that we care for our country. That's not the way that we care for our people. And there's so many things in there that are part of an agenda that have nothing to do with coronavirus relief. And so at this point in time, you know, I haven't had a chance really to read the 1,800 pages at this point. I'm going to be a no because we're just not concentrating on the things that we need to concentrate on. We're doing a wish list of other things, and I just don't feel that's appropriate at this time.
Congressman Butterfield.
Thank you very much. My colleagues just mentioned the fact that we introduced today the HEROES Act. I'm very proud of it. I plan to vote for it on Friday. But between now and Friday, we're going to be working very hard to make this bill a bipartisan bill. The last 4 investments that we've made over the last few weeks, I'm proud to say, have been bipartisan. Many of my colleagues on this town hall meeting this afternoon voted for these pieces of legislation. And so I'm not going to give up hope on our Republican colleagues because 50 governors across the country are asking us to quickly and boldly appropriate money so state budgets will not go underwater. Mayors and towns and counties across the country are asking for help. School systems whose students are out of school right now and teachers are not able to deliver quality education to the students, they're asking for support. And so we do have a $3 trillion massive HEROES Act piece of legislation. We're asking for support. We will have an opportunity to vote on it Friday. I will be voting for it. I hope my Republican friends will join us. If not, we'll send it over to the Senate and try to reach a bipartisan agreement in the Senate.
Okay, thank you. Congressman Hudson.
Well, thank you. I will be voting no on this bill. It's a $3 trillion, 1,800-page, job-killing boondoggle of a bill that was written in Nancy Pelosi's office with no input from Republicans, no input from the Senate, no input from the president. It bails out pensions that are overfunded. It changes election laws. It wipes out provisions in the tax code that we did in the CARES Act that provide liquidity so that businesses can keep going and keep people on the payroll. It's a terrible bill, and shame on Nancy Pelosi. People in my district are hurting. They expect us to work together to solve problems, and yet here we're being asked to come to town to vote on a bill that she knows Mitch McConnell's not even going to consider. And frankly, I've been asking her for weeks to call us all back, that Congress ought to be working. We've got essential workers that we're expecting to show up to work every day, and yet Nancy Pelosi thinks Congress is not essential. I think she ought to call us back to work. Let's hold hearings and do the things that need to be done to address the needs of our constituents in a bipartisan way instead of having this show vote we're going to have Friday.
Congressman Bishop.
Well, I was listening to my friend Mr. Butterfield's comments there, and I agree with what Richard Hudson just said. A $3 trillion bill, biggest in the history of the United States Congress, it would be if passed. And you can't make that bill bipartisan by throwing it out there 72 hours in advance of a vote. It just doesn't work that way. Among other things, it mandates absentee ballots across the country, same-day registration. Ballot harvesting is to be mandated. I mean, it's just a wish list of Democratic priorities. It's not a real serious legislative effort. And I do think we need to be back in Washington. I'm in Washington now. Even though Speaker Pelosi has declined to call us back, I'm going to be here every week because we need to be here working in a bipartisan way to help the American people who are suffering in this very difficult time. Not partisan games, but real serious legislative efforts.
Congressman Bishop, thank you for that. Let's hear from Congressman Price.
Well, I have here in my hand a a section by section summary of this bill, and I'm just listening to my colleagues, and I don't recognize it from what they're saying. The vast majority of this bill is continuing things that they voted for, and that surely we have to agree are still needed until the country opens back up. The vast majority of this is for another set of direct payments, a continuation of the unemployment benefits, a continuation of the payroll protection plan. All of those things are simply continuations of things that they've all voted for, and that's the vast bulk of the bill. What else is in the bill? A good deal of money for additional medical research, some money here for testing and tracing. Surely everybody who wants to open the country back up has to agree that there needs to be testing and tracing. Yet we haven't had a national program. We haven't had an adequately funded effort. So there's money in here for testing and tracing. So if you want to open the country back up, we got to have the testing and tracing.
Okay, Congressman Price.
I just don't recognize the description that we've heard here of what's actually in this bill.
All right, now let's hear from Congressman Budd.
Well, thank you. You know, this is what Washington calls a messaging bill. It's not an attempt to legislate. It's, I was with the president on Friday and I said, Mr. President, we have been here for weeks. We've been calling Nancy Pelosi to give us something legitimate to work on. This is 1,800 pages. It's 347,000 words. There's been no bipartisan negotiations. It's written in secret. It's a partisan wish list from Nancy Pelosi. And this is the exact opposite of what was in the CARES Act. And by the way, there's still $120 billion left for the PPP. It was going out at $2 billion per hour. Now it's going out at less than $1 billion a day. Because largely these businesses and small businesses that are employing about half of our workforce in the country, it very successfully funded them and kept them intact so that we could reopen our economy. But this bill, it's a partisan wish list from Nancy Pelosi. I would not support it.
Congressman Budd, thank you for that. So much to get to tonight in our Congressional Town Hall when it comes to COVID-19.
Coming up, more of your questions, including concerns with remote learning and internet in some of our rural areas.
Our Congressional Town Hall continues now with a focus on the federal Head Start program, which helps children in low-income families. Let's take a listen.
My name is Santana, and I'm from Thomasville. My question for our representatives specifically is about Head Start and low-income children. I need and want to know what you guys plan to do for these children who are low income and enrolling for Head Start. Also, other summer programs that accommodate low-income children.
And Congressman Hudson in District 8, you have certainly done some work on Head Start. How will you help ensure that children are taken care of?
Well, Head Start's a very important program to me. My mother is a retired Head Start teacher. And so all my life, I've heard stories of the impact she was having on these young lives. I believe in Head Start. And in fact, I had the National Head Start Director come to Concord because we were having trouble with our county Head Start program there to get it restarted. So this is something that's very important to me. I'm not sure what's going on in Davidson County in Thomasville, but I do know in our district, it's a challenge right now to try to provide services for the children. But our Head Start programs have stepped up. Initially, they were doing feeding until the school systems were able to get going. Folks who are in Head Start programs are allowed to take part in the lunch program provided by our local school systems. But as far as getting services to those children, the real challenge is access to Wi-Fi, access to computers or laptops. Thankfully, Charter and other organizations are providing free Wi-Fi. Our local school systems and counties are working with Head Start to try to provide computers in homes where they don't have them. So it's a real challenge right now, and it's one that we're continuing to work on.
Okay, thank you. And to go along with the internet, a lot of you working from home, your children are learning from home, but internet reliability is a real issue in many parts of our state.
Hi, my name is Cindy. I live in Pamlico County, and I was wondering, since the COVID-19 stay-at-home mandate, if there's been any initiative to supply rural communities with reliable, affordable internet connection so working at home and schoolwork is possible.
So Congressman Murphy, we'll start with you on this one. Are there any initiatives to supply rural communities with reliable, affordable internet connection?
This is a critical issue for our state. I worked on this when I was in the General Assembly in North Carolina. One thing that we've seen from a medical standpoint is now through the passage of the CARES Act, we're doing a lot of telemedicine, which has been critical for people to get access to medical care without having to leave their house since the stay-home order. And so now also for the same thing, it's unfair for children to be sent home and say, okay, it's time for you to do your homework, and they don't have the resources that they need. They don't have the internet access. They can't get to the library. It's critical. Unfortunately, our state budget did not get passed this past year. It got vetoed. There was money in our state budget to look at rural broadband for our, especially for our rural areas. It is something that definitely, I would love for our states to be the leader on this. But if we need to, as part of this package, if we need to help those people in rural areas, not only with telemedicine, but for education, for teleworking, then I think that's going to be an important pathway for us getting back to normalcy, for folks getting back to work and staying healthy.
And Congressman Budd, as a member of the Diversity and Inclusion Subcommittee, what's being done to help those in rural areas?
Absolutely, and that's a great subcommittee to serve on with Representative Alma Adams. Look, I live in a rural area, so this one's very personal to me, especially since we're doing the quarantining like this. But I sent a letter to the USDA back in April asking them for additional funding and additional support for rural broadband. I asked several of these members that are on the call with us tonight join me in this letter. Also supported different provisions in the CARES Act that we passed three or so weeks ago. Had $100 million in there for rural broadband. And Representative Murphy, just a few minutes ago, he mentioned $200 million in there for telehealth. I supported that. $25 million in there for distance learning, and $2 billion in there for telemedicine just for our veterans. And I have a large VA presence in Rowan County, Salisbury. So we're very sensitive to veterans' needs. Of course, around our whole state, we have so many veterans here. But definitely want to support rural broadband and different versions of that, including telehealth.
Let's go ahead and talk to Congresswoman Adams as well. Congresswoman Adams, you are very passionate about education. That's your whole legacy. So what do you think is being done to help those in rural areas get the internet that they need?
Well, I would certainly encourage my colleagues to take a look at the bill that we're going to vote on this week, because certainly we have made provisions for broadband and really know that it is a problem in urban communities, as well as even in my community here in Mecklenburg, as young people are now working from home, don't have the computers or the internet access that they need. So we're trying to bring some parity and clarity to this process. And again, I know they haven't had a chance to read the bill, but I can tell you that the things that you're talking about are absolutely there. And I certainly, it sounds like we're going to have your support, and I appreciate that. So it is essential. If children are left out, if they're not able to have the resources at home, many of the schools are sending computers home with them, but we have made a concerted effort in this bill to include broadband, and it's going to happen. We need your help on that.
Representative Adams, thanks so much for that. So much more to cover right now. More of your questions, including what options are available for all those small businesses struggling to just pay the rent. We'll be right back.
COVID-19 response, Congressional Town Hall.
Welcome back to the COVID-19 response, a Congressional Town Hall.
We continue our virtual conversation tonight with representatives of 8 of North Carolina's congressional districts. In response to the COVID-19 crisis, Congress passed the biggest spending bill in history, more than $2 trillion. And some of the goals: get more money in your pocket, help people who are unemployed, and keep small businesses afloat.
So how has it worked, and what more could Congress do? Our Capitol reporter Michael Hyland has a closer look.
The changes COVID-19 brought to our lives were stunning in their speed. It set off a scramble as thousands of people overwhelmed the state's unemployment system.
I made 264 calls.
Honestly, I'm going to say over 1,000 times.
In less than 2 months, more than 1 million unemployment claims have been filed in North Carolina, representing 861,000 people as of Tuesday. As part of the CARES Act, Congress approved giving people who qualify an additional $600 per week. That runs until the end of July, leaving people to wonder what's next.
And until the government or people open up public gatherings of thousands of people like me are going to be out of work.
At the same time, the CARES Act included one-time payments to millions of people. A family of 4 stood to get as much as $3,400. As of Friday, the IRS says more than 4 million payments have gone out in North Carolina, totaling almost $7 billion. Congress is debating whether to send out another round of checks.
We need a big, bold plan.
Before we rush back and do the next bill and spend more taxpayer money, we just want to be thoughtful.
Small businesses also have struggled, with some looking for help through the Paycheck Protection Program. It helped keep some businesses going, but the money quickly ran out before businesses like Modern Apotheca in Raleigh could get any of it. Congress came back and approved a second round of funding. Zach Medford, who owns several bars in Raleigh, got some of the money. He says it couldn't help because he would have to rehire staff, even though it's not clear when bars will reopen.
If we're only able to have 5 people for every 10 that we're used to, that's a huge drop in revenue.
In Raleigh, I'm Michael Highland.
So a lot of people saying the financial help just hasn't been enough. Congressman Bishop, let's start with you. As part of the CARES Act, the additional $600 per week runs until the end of July. So what happens then?
Well, that's exactly why I said earlier that we may need a recovery package. But the very first order of business is we've got to reopen so that businesses can begin to operate again, and so that people's jobs can be made secure. And there are various items that we're looking at. One thing is called patient capital. That is to say, there may be some things we can do through the Small Business Administration to make it so that businesses can have a longer deferral before they begin repaying, recommencing debt service payments and the like, in order to let them get stabilized as we begin to renew business activity. That's the key, though. We've got to relaunch the American economy, and we've got to might have to have a recovery package to support that.
Okay. Congressman Walker, do you think enough is being done financially?
Well, I don't think you ever get to the place where you say you can do it enough. As a former pastor, I remember meeting with many families on many different occasions. You never felt like you could quite do enough. This isn't just a financial issue. This is an emotional one as well, because families are really hurting. Both my mom and dad tested positive for coronavirus. Now they're thankfully on the backside of that, but this is impacting many different people in many ways. But where do you put an end to it? One quick aspect I wanted to add as well, in the CARES Act, speaking of some of the people that are unemployment, whether in the rural communities or urban communities, the number was 1.5 billion with a B that we added for broadband. We're doing everything that we can to make sure that people have all the access and all the tools, but you have to ask your question at the end of the day. Is it government's responsibility for an indefinite time to continue to roll out the checks for here to infinity? One last point I want to make. I have a friend, Mark Ashley, runs the company Market America. They are hiring people, but they are struggling. Their entry wage is $12 to $14 an hour. But as long as the $600 is an automatic on top of whatever else that someone's getting, it's very difficult for these small businesses to be able to re-engage all our people. This was a great point that Senator Tim Scott made in passing this. We've got to make those transitions to allow businesses to reopen, but allow those starter wages, those entry wages, to be able to go as far as they should.
Okay, and we're certainly glad to hear that your parents are okay. Now, Congressman Price, how are you making sure financial support is there?
Well, there's nobody on this program who doesn't want the country to reopen and get back to something like normal as quickly as possible. But wishing does not make it so. And I think there are doctors among us will not disagree with me when I say that the best scientific testimony we have these days is that it would be dangerous to reopen too soon. It would be counterproductive to open things up and then to have a recurrence of this, a resurgence in the fall. And I do think that's a very, very real possibility. So we need to do this responsibly, and that means we need to hang in there in government as well as throughout the society, and provide the bridge support that our people and our businesses need to make it to the other side. We can't stop prematurely.
Congressman Price, thank you for that. Our next question for Congressman Butterfield. Let's take a listen.
Hello, my name is Kedra Mims, owner of Rivals Barbershop. I'm a barber from Durham. And we were forced to shut down due to COVID-19. And what I want to ask lawmakers is that, are there any federal programs to forgive rent? Because it's been very difficult paying rent, being that we have no income coming in at all.
Mr. Butterfield, we are hearing this question time and again from Main Streets all across North Carolina. How do we fix it?
Well, let me first thank him for asking this question. We've been asked that several times over the last few weeks, and I'm pleased to let you know that in the HEROES Act, which we introduced today, will include more than $100 billion for rental assistance for people who are not able to pay their rent, directly attributable to the coronavirus. Not only do we protect the tenants, but we also protect the landlords as well. And so you will see more than $100 billion in the legislation for rental assistance. And we understand that this is a challenge for so many people out of work and simply not able to pay their rent. If you own your home and you're out of work because of the pandemic, and you live on property that has a federally backed loan, for example, a VA loan, FHA loan, or if you live in a rental apartment that's under Section 8 housing, we have a provision in the CARES Act that will prevent you from being evicted. We are trying to work out the details as to what happens to the 4 months rent that will be delayed. Perhaps it will be added to the end of the mortgage. But we are very sensitive to the needs of the American people who are being affected and hurt in a very significant way. This package undoubtedly is bold. It's big. I'm glad we're having a chance to debate it now. We will be voting on it Friday. But please note that this package is equal to the crisis that is gripping our nation. It's going to protect lives. It's going to protect livelihoods of the American people.
Congressman Butterfield, thank you for answering that question. We got to take a quick break. The COVID-19 response Congressional Town Hall will be right back.
We know the federal government has approved 2 rounds of payments for small businesses through the Paycheck Protection Program.
Well, just last week, 24 attorneys general, including our own Josh Stein, sent a letter to congressional leadership saying, quote, Congress must do more to ensure that large companies do not pocket these funds at the expense of our small businesses. Congressman Richard Hudson, what can be done for better oversight? A lot of people asking that question today.
Well, it's a fair question. There were a number of companies that made headlines, large companies that got these loans, and I think many of those have given those loans back. I think the key to understand is that the Paycheck Protection Program has been a big success. It was a program that normally we take 3 months to roll out a new program. We did this in about a week, and the bottom line is we've saved 50 million jobs across this country. And in fact, 100,000 loans went out just in North Carolina, about $13 billion, about 765,000 jobs that were saved because businesses were able to access this liquidity. And the key was that they keep their employees on their payroll. And so that was really the point of it is, we want to keep as many businesses whole as we can, but we really want to keep those workers in those jobs because of what that means to that individual if they don't lose that job. And so, yes, there were some issues with it. I think there are a number of things that we continue to need to look at. For example, a number of minority-owned businesses in my district are having trouble accessing this. I think we ought to examine that. One of the issues I've raised with leadership, that's one of the reasons I think Nancy Pelosi ought to bring us back to work. We need to look at some of these issues. But the good news is that 74% of the loans through Paycheck Protection Program went to businesses with a payroll of $60,000 or less. So the majority of this money is going to small businesses. The second tranche of money that we all approved in a bipartisan way had set aside money for small lenders so that would get in the hands of smaller businesses. So it's not a perfect program. I agreed with a number of the suggestions the Attorney General's raised on ways we can improve the program. We ought to come back to work and do that.
Our next question keeps the focus on education and the financial impact caused by COVID-19.
Hi, I'm Leah, and I'm from Cary. And my question is student loan forgiveness really on the table, or are those just rumors that I keep hearing?
Congresswoman Adams, you introduced the Student Loan Relief Act. Briefly tell us where this stands.
Well, we are going to, in this next package, help with some of the student debt. Whether you took out student loans or student debt, it's been a tremendous ball and chain around the necks of many of young people, because you can't discharge it in bankruptcy. It balloons for students who can't repay the loans and so forth. We were trying to, I did have a bill to try to increase at least some debt relief, which I think we need to do. If we can forgive Wall Street, we can forgive Main Street and our students. And so we have about 20,000 in this bill that we'll vote on Friday for a student debt cancellation. So certainly we were hoping for more. We were able to obtain $10,000 in the borrowers in the HEROES Act. Now I've filed a number of bills, one a bipartisan bill with Representative Stephanie, who's a Republican from New York, to create some equity in terms of the Student Loan Relief Act. And so we've done that. I also filed and was able to get past the Futures Act. Not a part of this stimulus, but it was an earlier bill, and so it's going to help a lot of our students, particularly it was designed for our HBCU. So it's an important step to really look at students so that they can become taxpayers, so that they can buy property, they can buy a home, a house, a car, those kinds of things, and really put money back to in our economy. So certainly investing in young people, I think it's a good investment for our economy.
Okay, thank you for that answer. Now, our next question focuses on food insecurity.
From food banks to school distribution meal sites, there has been a lot of work across the state to make sure that people do not go hungry. Let's listen to this question.
My name is Scott Andrew Bowen. I live in Winston-Salem, North Carolina. I am the manager of a food pantry here at a local church. We serve about 400 families each month, and since the shutdown, we have seen an increase of people coming by for food assistance. With the prediction of possible recession in the economic section, we expect to see more people who are in food insecurity and who may be suffering economically. So my question is, what is the state prepared to do in the future for people who are in need, who are going to be impacted by the shutdown that's happening? Thank you.
Congressman Budd, I ask you this question. What can Congress do literally to make sure there's food on the table?
Well, to Scott, you're in my hometown, and I thank you for what you're doing. You probably didn't know, nor did I 3 months ago, how important your job would be. You knew it was important, but it's absolutely essential right now. So thanks for what you do. We see and your question was largely to the state, and so that's to the folks in Raleigh, but to those in Washington, tremendous amount of support for SNAP benefits, and a lot of that funding is going to be directed to different food banks. Perhaps Second Harvest Food Bank is going to be supplying your food pantry, and that's where a lot of your funds, a lot of your supplies come from. So anyway, we want to make sure that there's enough funding for those types of food banks, which can supply your local food pantries. But you absolutely important role that you have right now, and I'm grateful you're there.
Congressman Butterfield.
Well, first of all, let me also thank you for the question. Food insecurity is an issue that we have been dealing with for years and years. And finally, I think the American people finally understand the importance of this issue. So many people are hungry. So many families are food challenged. And that's why food banks are so critically important. Our pantries are stepping up to the plate. We're trying to find a way to get some of the excess food that we hear about and see about on television, to get FEMA to get these excess commodities and deliver these commodities to food banks. In the bill that we introduced today, the HEROES Act, there is a significant increase for SNAP, that would be food stamps, for those low-income families who need assistance in purchasing food. I'm very proud of the HEROES Act. It's a major step forward. It is a bold initiative, but it's going to lift the American people. It's going to lift families. It's not a boondoggle. It is about investing in families and businesses in America so that we can bring this economy back. Hopefully we can talk about state and local support before the program is over, but we're investing almost $1 trillion in helping states and local governments prevent a disaster at the local level. We know what happens when cities and towns and counties do not have the resources. They have to cut services. Sanitation, police, and fire and first responders, they have to cut personnel, or they have to raise property taxes. And so mayors and governors all across the country are asking us for help. And almost $1 trillion is in this bill for state and local assistance, not to mention the $90 billion that's in there for education.
We have time tonight for one more lightning round question.
All right, so this question goes to everyone. You'll get 30 seconds to respond. We know a lot of money is going into research and vaccine development, but we want to talk about antibody tests. Do you think, with a reliable antibody test, that the federal government should pay for every single American to get one? A lot of folks say they don't feel comfortable going 100% until they know if they've been exposed. By a show of hands, who would support that?
Let's go ahead and start with Congressman Bishop. Why do you support that?
Yeah, look, just in the past legislation, most recent bill, we added, I think the number is $25 billion for testing, moving into the phase after having expanded testing, really thanks to the great efforts of the private sector commercial labs who, we've tested, I think, close to 10 million people for diagnostic testing. The second phase, the testing for antibodies or serologic testing, also needs to be done, needs to be widespread, so the $25 billion we've already passed will go a long way toward doing that. It's not something people should have to pay for, in my view, and we can and will get that done. All
right, Congressman Walker, we're trying to keep this to 30 seconds so we can get out on time. I know you got a lot to do.
Yes, there's a qualifier here. If it means that the individual can go back to work, then I'll certainly be one that considers it and we'll discuss it. But until it's like we're getting the cart before the horse. Let's make sure we define that before we have the government pay for additional tests.
Okay, let's hear from Congressman Price.
Testing is absolutely critical to getting the country opened up again. As we said earlier, this next bill focuses on widespread testing and tracing. Now, the antibody test, of course, is hopefully would tell you if you're safe to go back to work and if you're immune to the disease. But what we can say about that, how good it is going to depend on the science. And the science just isn't there yet to tell us whether we have an adequate antibody test, or even if you prove negative or if you prove positive for the antibodies, whether that means you cannot contract the disease again. So your question's, I'm afraid, premature.
Congressman Murphy.
As a physician and scientist, there's a great deal that we know about testing that we did not know 3 months ago, but there's an even greater deal that we don't know about testing. If you test negative today, should you get another test tomorrow or next week or moving forward? There's a lot of things that we need to do moving forward before we start blanketing the entire country with every single individual being tested.
Okay, we're running out of time, so very quickly, Congressman Budd, yes or no?
Yeah. We've already performed over $9 million so far. I supported billions of dollars in the CARES Act for antibody testing, and I believe that anybody who wants one should get one, but there should be no mandate, like was in your question, that everybody should have one, only if they want it.
Congressman Butterfield.
Testing, testing, testing. We must engage in diagnostic testing as well as antibody testing, and we need to target unserved communities. There are so many minority communities across North Carolina that are not being tested sufficiently. We have community health centers that are ready to do the job.
Thanks for joining us tonight.
Thanks so much for being with us.